Hello and welcome to part 2. In this section, we're going to be looking at our performance figures. In February, there were 2 avoidable cases of C. diff due to lapses in care, which brings our year-to-date total to 20. However, we have exceeded our year-to-date trajectory for the total number of cases. We have achieved our target for harm-free care, which looks at inpatient falls, pressure ulcers, blood clots and catheter-associated urinary tract infections. We also have achieved our target for patients who are at a risk of a mini-stroke receiving treatment within 24 hours. However, we didn't achieve our standard for 80% of stroke patients to receive 90% of their care in a stroke ward, and we also missed our target for 90% of stroke patients to be admitted within a stroke ward within 4 hours. Whilst these stroke figures are disappointing, performance is improving. Additional stroke beds have been made available, and designated beds on MAU will support patients in the short term who show signs of minor strokes. We're looking at ways to improve the stroke pathway even further, and collaborative work is ongoing with partner organisations. In February, we achieved 7 of the 9 key standards for cancer patients or people with cancer symptoms. We missed the standard to complete treatment for 90% of inpatients within 18 weeks, but we did achieve the standard to complete treatment for 95% of outpatients within 18 weeks. The number of patients waiting more than 18 weeks of treatment has been steadily growing as procedures have been postponed when the hospitals have been busy in recent months. We're working hard to schedule procedures both in our hospitals and in private hospitals and facilities to make sure patients who've been waiting for their procedure are treated as quickly as possible. We missed the target for emergency department patients to be admitted or discharged within 4 hours. We also just missed our target for patient experience. However, 91% of inpatients who completed the friends and family tests said they would recommend our services, which is higher than previous months. That's the end of part 2. Please click on the link to watch the third and final part of the podcast.